Welcome back to the NCTTRAC series, and welcome to the first of the Texas EMS Wristband tutorial series. This video is aimed at providing vital information in the utilization and application of both the Texas EMS wristbands and the EMS triage wristbands. Specifically, this video will be focusing on guiding leadership staff within both hospitals and EMS agencies through the entirety of the Texas Wristband program. Let's begin by discussing the overall goal of the project. As the name suggests, through the everyday use of the Texas EMS wristband, healthcare providers will be able to utilize the unique identifier to link medical records and/or patient data delivered from EMS throughout the continuum of care. The initiative is aimed at improving healthcare delivery and patient information management throughout the state of Texas. Since the project's inception, it has gained significant traction and support from various stakeholders, including the Disaster Preparedness and Response Committee through the Governor's EMS and Trauma Advisory Council, also known as GTAC. In March of 2022, with the backing of Senate Bill 500, all 22 Texas Regional Advisory Councils, or the RACs, began leading the implementation of the project by managing the distribution, training, and overall progress reports within their specific regions. Due to the project's current progress, there are broader implications in the near future. As mentioned within the recent statewide meetings, there is now expectation that the project will be referenced by the Texas Department of State Health Services within the upcoming trauma rules for both EMS providers and hospitals. As referenced below, revisions to 157.125 states that the EMS wristband tracking number will be required for integration within all trauma facility patient care records, as well as included in the registry abstraction and submission to the state registry. Additionally, there are current requirements that the EMS triage wristbands fulfill, primarily in the Emergency Medical Services Rule 15711, covering EMS provider requirements. As initially stated within the rules, EMS providers must have 25 triage tags per vehicle in coordination with their assigned RAC. The EMS triage wristbands assist in meeting this requirement, while also continuing to maintain the wristband project goal of utilizing a unique identifier in tandem during MCIs. We'll explain further in the video how the described program requirements will assist you and your organization in meeting these upcoming changes in the future, setting you up for an easier transition. Now let's take a closer look at some of the advantages the Texas EMS wristband and the EMS triage wristband has to offer. Imagine one of many possible situations where a mass casualty incident, an evacuation, or disaster may occur. With the Texas EMS wristband, or specifically the EMS triage wristband, patient accountability has become a top priority. It ensures that every patient can be accurately identified and tracked throughout the entire healthcare journey, regardless of the agency or facility they transition to, providing a reliable tool for the reunification process. Another valuable aspect of the wristband project is how it expedites record reconciliation and matching across different agency systems. Imagine the time-consuming process of manually reconciling patient records across various systems. This project streamlines that entire process. Providers can save valuable time and reduce errors by utilizing the wristband tracking number for faster, accurate record location. Additionally, the project facilitates the sharing of outcomes between pre-hospital and hospital organizations. By exchanging patient outcomes through the utilization of the unique identifier, valuable insights from hospital providers can be shared with pre-hospital staff, ensuring a smoother transition of care and ultimately enhancing interregional collaboration. Lastly, the Texas EMS Wristband Project saves precious time when it comes to locating and accessing patient records across multiple systems. Searching through different databases for information can be time-consuming and potentially delay services. However, with the wristband, healthcare providers can swiftly retrieve the necessary records. This saves time, increases efficiency, and allows for more focus on providing quality care to patients. Overall, the anticipated value of the Texas EMS Wristband Project is immense. It establishes patient accountability, enhances data location, expedites record reconciliation, facilitates outcome sharing, and saves time in accessing patient records. By implementing this project, healthcare providers can deliver a more efficient, cost-effective, and patient-centered care across disparate systems within the state of Texas. Moving on, we'll now detail the 2 wristband options within the program. We'll first begin by going over the structure of each wristband, starting with the Texas EMS wristband. The single teal band provides a striking contrast from most bands used in the healthcare field. Within this close-up, you'll see the main portion of the band with both the barcode and the readable, unique alphanumeric characters. The clasping mechanism is also similar to other common bands utilized within medical facilities. These wristbands are designed for everyday usage, with emphasis on making them a standard part of patient care. The goal is to utilize this band on every patient every time. Moving on, we'll lead into the more detailed option, the EMS triage wristband. These wristbands have a specific use and structure to provide support for mass casualty incident events, or MCI events. As highlighted here, there are 25 wristband tags per bundle, with a tearaway feature to remove each one. When applying to a patient, thread the end of the band through one of the loops found at the base of the barcodes, before removing the adhesive tab found on the end. Please remember, do not remove the adhesive until after it's been threaded through the loop. Additionally, an advanced feature of this band is the triage color tabs at the end. This capability will work with traditional and contemporary triage methodologies, such as SALT and START. EMS providers are encouraged to use the removable tabs to provide a physical status marker on their patients. Further down on the band, you will find 3 additional barcodes that copy the main unique identifier on the inner band. This will allow for other healthcare providers to keep or share a physical copy of the information on the patient, such as giving a copy to other agencies or facilities, as well as attaching onto patient belongings, as shown here. Please note, if the EMS triage wristbands are unavailable on the scene of an MCI, the project encourages usage of the Texas EMS wristband as an alternative. Although the triage portion would be missing, the key component of the unique identifier would still be utilized. As with both bands, their structure and layout optimize the full aspect of the easy-to-record ID information. With the structure review now completed, we'll move into the program requirements highlighted for both the EMS and hospital providers. As providers begin implementation of each wristband into their daily operations, there are a number of program requirements that must be upheld when providing patient care. Below you will find the training videos specific to both EMS and hospital providers. Leadership of these organizations are encouraged to apply these options when providing education and training to their clinical staff. The components highlighted in these videos will ensure that proper procedure and understanding of wristband placement are followed during routine operations. Please utilize the QR codes below for access and download options for future use. In conjunction with the program requirements, we would also like to provide easy access to Pulsara's options for organization enrollment and training. As mentioned within the clinical training videos, Pulsara's patient tracking application, specifically for MCI purposes, is a requirement for the Wristband Project. As such, we've made all portal options available within our Texas EMS Wristband webpage for organizations to access. Each option is labeled based on each organization type, and separated based on enrollment and training resources for daily or MCI use, as shown below. Finally, we'll cover how organizations can acquire their supply of wristbands. In order to ensure that EMS agencies and hospitals have an adequate number of wristbands, there are certain guidelines regarding quantity eligibility. To begin, we'll go over each provider type and discuss the options available to them. For EMS agencies, both the Texas EMS wristbands and the EMS triage wristbands are available for distribution and acquisition, as they are the providers to initiate care to patients in an everyday setting or by an MCI event. For the everyday Texas EMS wristbands, Agencies may receive an amount equal to their total number of recorded transports reported to DSHS in the previous year. This allocation is based on the agency's transport activity and ensures that a sufficient supply is readily available for their expected patient traffic. For the EMS triage wristbands, their intended use is specific to mass casualty incidents. Unlike the everyday wristbands, these triage wristbands are placed on all first responder units, such as engines, ambulances, and EMS supervisor vehicles. Each apparatus may receive a bundle of 25 EMS triage wristbands, ensuring that the response units are equipped with the adequate supply for MCI events. The number of each first response unit within the agency must be provided within the request portal to be recorded and reviewed by RAC staff. Next, we'll cover hospital providers and their available options. During the request process, only the Texas EMS wristbands will be available for facilities to obtain, not the EMS triage wristbands. For the Texas EMS wristbands, facilities may receive an amount equal to their total number of interfacility transfers for the previous year. This information must be provided by hospital staff within the request portal for record and review. Additionally, both EMS and hospital providers will be expected to provide their active Pulsara account information, as this is a requirement for the Wristband Project for MCI patient tracking. You're now ready to move on to the NCTTRAC request portals. Utilizing the QR code found on the right-hand side, you will be directed to the Texas EMS Wristband Project webpage. Along with program review information, you will also find the request portals tailored to both hospitals and EMS. From there, you will be directed to the electronic forms, where the following required fields will be listed. Please have this information readily available before beginning your request. Once completed, RAC staff will begin the process of verification by reaching out to the requester listed within the form and review the quantity requested by the organization. Finally, the delivery information will be provided once organizations are approved. This will be known to the requester by our logistics department. RAC staff will discuss and determine delivery options, including details on specific pickup dates and times from the NCTTRAC warehouse. For any further logistics questions, please review the contact information provided. We hope this provided a comprehensive breakdown of day-to-day usage for the wristbands. As always, RAC staff is available should you have any questions over any of the components. We also encourage you to visit the NCTTRAC website, specifically the Texas EMS Wristband Project webpage, where additional information and resources can be found.